However, the symptoms have since worsened, the impactions got worse, and they came across my YouTube channel. And the young girl actually watches my videos. This is amazing. And it was so cute today that she said that one of my videos is very fascinating. So it's very mature for a 4-year-old to say. And she's really looking forward to having her ears cleaned, because her main symptoms, as well as reduced hearing and a blocked ear, was that she's getting really quite itchy ears. And just in the left ear, now the wax is a bit softer than I would like, although it did come out in big clunks. You'll see the wax a bit deeper, it was a bit slushier, and so already you can see the eardrum, so the patient's hearing would have improved. But I just wanted to get as much wax out safely as possible, especially with children. You don't want to overdo it. And so just I did start off with a fine end suction probe. That wasn't powerful enough, so I had no option but to use the full Zollner suction probe, and you can see we got that medial wax out near the eardrum. Lovely healthy eardrum, short process of manage, slightly protruding, but that can happen with children. It's just the shape of the hammer bone. So onto the patient's right ear. This ear was a bit worse, I feel. It was a bit more impacted, and there's a bit more residual wax stuck on the perimeter of the ear canal. Now, I promised her that I would upload this video today, hence why I'm doing it right now. And I also said just so she knows it's her video, that I'll make reference to the pink earmuffs that she was wearing today, which was so cute. She was a bit shy, and her mum did say to her, if you don't say thank you, that I won't upload the video. And she said a really, really big, loud thank you at the end. And I'm sure she's going to be really excited to watch this. You see there's a couple of strands of hair. These hairs are actually from her, the outer hair on her scalp. They kept getting attached. Although I pulled the hairs back over the ear, when I went in with the suction probe, the hairs did actually come inside. So again, to see the eardrum now, I've just reverted to the fine end. I just wanted to get, okay, we're not trying to get every little speck of wax out, but there's a bit more here than the left ear. So, and it's on the anterior recess. I just wanted, and she was so still, so I just wanted to get a bit more out here. Now, a bit of wax is good for you. I explained that to the patient's mother. And the left ear, you probably saw a speck of wax on the drum, and I explained that's absolutely fine. We're not going to try and remove that because it's healthy, natural wax, and by being a bit too cute and clever, we can cause injury and trauma and possibly even perforate the eardrum, which we don't want to do. So again, just gently, just trying to get this softer wax out, because it's not too deep near the eardrum there, so I was happy to do it. And the patient is really, really still. So there is going to be some residual wax in the video, guys, and so as I said, that's no problem. But just here, there's a bit stuck behind the anterior recess. I wanted to try and get this out if I could. When you've got wax stuck in the anterior recess, sometimes it gets trapped there and it won't come out by itself. Now, using drops can be counterproductive. In children, I do prefer, so when the parents book in, I do advise them to use olive oil drops prior to attending. It in some ways can make the procedure quicker. Now, one of the negatives of using excessive drops is this mushy wax you can see, and there's just a bit stuck there still in the anterior recess, although the whole eardrum is clear now, you can see. And when you've got mushy wax, yeah, as you can see, it can be a bit tricky to remove. So it's a fine line now. It's the first time I met the patient, so I don't know too much about their ear history. You can see I've just bent that tube just to get in the anterior recess, just to gain access. She was really still, bless her. And with most adults, I ask adults to attend without using drops because, like I said, it can be counterproductive. I hope you enjoyed.